spectrum of neurofibromatosis, evaluating Jackson and Lee's
Good afternoon,
classification
esteemed
by
judges
J.
and dear
Gayatri.
friends. My motto of my presentation is to make everyone aware of a pre-existing Jackson and Lee's classification for neurofibromatosis, which is a very common condition encountered in daily practice. We are all aware that neurofibromatosis is an autodominant disorder with an incidence of approximately 1 in 3,000 births. That is, we encounter neurofibromatosis cases in our day-to-day practice. The patient may develop grossly disfiguring neurofibromas of the orbital, temporal, and facial region. Neurofibromas come under the category of hamartomas, and they consist of Schwann cells, nerve fibers, and fibroblasts. The unique thing about neurofibromatosis infiltrated tissues is that they are very vascular with wide open capillaries which bleed copiously during surgeries, and they are neither circumscribed nor encapsulated. So the signs can vary from a simple subcutaneous swelling to a classical skeletal abnormality involving the absence of greater wing of sphenoid, which can be partial or complete, to a pulsatile proptosis, which is even due to a meningoencephalocele or a total temporal lobe herniating into the orbit. Our purview is intraorbital neurofibromas, which causes eventual bony enlargement with hypoplasia of the supraorbital and infraorbital rims, zygomatous hypoplasia, and orbital 4 depression. Now, Jackson et al. Has already classified orbital neurofibromas way back in 1994, but not many of us are aware of such a classification. He has classified the orbital part with a condition of the eye. He classified it into orbital soft tissue involvement with a seeing eye, orbital soft tissue plus a bony involvement with a seeing eye, and an orbital soft tissue involvement with bony involvement with a blind eye. So few clinical examples of the same. So orbital soft tissue involvement with a seeing eye, an obvious sphenoid dysplasia with a seeing eye, and a sphenoid wing dysplasia with a blind eye. When Jackson has classified the orbital part of neurofibromatosis, Lee has classified the periorbital and palpebral aspects of the disease as brotosis, upper lid infiltration, lower lid infiltration, lateral canthal disinsertion, conjunctival and lacrimal gland infiltration. But classically, we don't encounter these strict forms into our day-to-day practice. So some clinical examples are here. Lower lid infiltration. So why? What is the motto of my presentation? Because the management of orbitotemporal neurofibromatosis is quite challenging. It often requires a multidisciplinary approach by an oculoplastic surgeon, a plastic surgeon, plus or minus a max fac surgeon. So classification, if we are aware of such a classification as the above, it helps in a tailored surgical treatment according to the severity of the condition, and we can give a better outcome to the patients. These are my references. Thank you for attention.